On behalf of the North Dakota Center for Nursing, my name is Milena Howe. I'm a registered nurse, business entrepreneur, consultant in community and business development. Today I'm speaking on lobbying versus advocating and what the difference is. So what is lobbying? Lobbying can actually be part of advocacy, but advocacy doesn't have to include lobbying. So what exactly is lobbying? The North Dakota Center Code defines a lobbyist as any person who in any manner whatsoever, directly or indirectly, performs the following activities. First, they can attempt to secure the passage, amendment, or defeat of any legislation by the Legislative Assembly or approval or veto of any legislation by the power of the governor of the state, or attempts to influence decisions made by a legislative council or an interim committee of the legislative council. Lobbying works with specific legislation. It is not as broad as advocacy. However, you are not necessarily a lobbyist if you are a legislator, a private citizen appearing on your own behalf, an employee, officer, board member, volunteer, or agent of the state or a political subdivision acting in an official capacity. If you were invited to appear before the council, interim committee, or standing committee to provide any information, or if you're an individual that appears before the legislative committee for purposes of providing testimony on behalf of a trade, professional organization, such as our nursing organizations, business or industry, such as our healthcare organizations, if introduced by the registered lobbyist for that organization. Lobbying can be direct or indirect. Direct lobbying is when it's directed to an individual legislator or a staff of a legislative individual, or it can be indirect, where it's dedicated to the public, which makes it very similar to the advocacy, again, the promotional materials and information that we send out on the public's behalf. So what is advocacy? Advocacy is a very broad term. It's actually a set of activities to change public opinion or get public support. Often it includes promotional materials, articles, feature stories, interviews, things of such. It is a very broad term, and advocacy is identifying, embracing, or promoting a cause. This cause could be appeal to individuals to change their behavior, employers to change rules, or the government to change laws. Lobbying refers to specific advocacy efforts that attempt to influence legislation. Nurses are advocates all the time. We're oftentimes talking about eating well, exercising, wear your seat belts, stop smoking. We advocate all the time on the patient's behalf or individual's behalf or the community health. On behalf of the North Dakota Center for Nursing, thank you for listening to our video on lobbying versus advocacy. This is Milena Howe.